Hi everyone, my name is Renee, and the healthcare system in the United States is leaving people behind. While we may not understand the consequences of this because we live in California, where we have access to publicly funded healthcare options such as Medi-Cal, right now we are living in a time in which doctor's appointments, emergency room visits, and checkups are coming at a price. We live in an age in which healthcare systems are costing people not only out-of-pocket expenses, but their well-beings. After celebrating his last night of freedom, groom-to-be Cameron Fisher found himself with one of the worst hangovers in his life. He could not keep his food down and found out later on, with the help of his soon-to-be wife pointing it out, that he was in fact severely dehydrated. Cameron Fisher was able to have access to an emergency room, replenish his fluids, receive proper care, and eventually become discharged. However, after being discharged, Cameron Fisher left the emergency room with a bill worth over $12,000. Kat Lahr has stated that current privatized, fragmented, and commodity-based healthcare systems cost more than public healthcare for other countries across the world. We are already paying the cost for universal healthcare, and then some. Single-payer healthcare can solve the inequalities in our healthcare system. Everyone in their life has received some form of healthcare, whether it be immunization shots, actual childbirth, or even a physical. All of that medical care comes at a price. My research includes Harvard studies, Forbes projections, and research from the National Institute of Health. I am an activist for Medicare for All, as well as an insured American. First, I will be talking about how uninsurance affects Americans' everyday accessibility to health. Second, I will inform you on how fiscal responsibilities placed on medical patients changes their everyday lives. And thirdly, I will address how Medicare for All eliminates inequalities for people with pre-existing conditions. With over 27 million Americans uninsured, we can see a myriad of groups facing socioeconomic barriers in receiving health care. Young adults are increasingly more likely to be uninsured. Young adults face the lowest rate of access to employee-based private health care due to a number of determining factors. Young Americans ages 19 to 24 make up 14.35% of the uninsured population, according to Forbes in 2019. The job market simply isn't prepared for out of high school and fresh out of college graduates to transition from full-time education to full-time employment. Elderly Americans, we actually see a decrease in insurance. Elderly people are the most vulnerable health patients. As they get older, their immune systems see a significant decline, making them more likely to develop a myriad of medical problems. Having a healthcare system that does not work for the elderly is like telling them that they are too old for us to care. We cannot turn our backs on the people who are the most vulnerable just because they are too old to produce capital. Race also plays a large factor in having healthcare. In America, African American and Hispanic Americans are the most likely to feel socioeconomic consequences first. This means when unemployment rates rise and jobs are cut and insurance is taken away, communities of color feel it the most. The National Institute of Health says that Black Americans and Hispanic Americans are less likely to have insurance coverage from their private employer, whether directly or through a spouse, and more likely to have publicly funded health insurance coverage than whites. Now that I have discussed 27 million Americans that are uninsured, I will now move on to the fiscal responsibilities placed on medical patients. With fiscal responsibilities placed on medical patients, we can see that kind of cost seeping into their everyday lives. In fact, the most common form of bankruptcy filed is medical debt-related bankruptcy. A Harvard study found that 62.1% of all bankruptcies in the United States were caused by medical bills. Americans find themselves in debt, paying out of pocket for things as simple as prescriptions, which can cost hundreds of dollars a month. In fact, Gerald Freeman, PhD, has noted that the cost of prescriptions under the Medicare for All legislation could be lowered by 31%. Due to fiscal responsibility, we are losing people to deaths that could have been prevented. In 2016, we had over 8 million avoidable deaths, causing the economy to lose $6 trillion in economic welfare. Due to the high cost of healthcare, people are deciding to skip out on their medications, causing further health complications. The Harvard website even has an article laying out on which medications you can cut if you do have to make those significant costs. The significant number of Americans that do not take their medications is far too much. In fact, about 8% of adults in America do not take their prescriptions because of the price. Now that I have discussed the real-life consequences of fiscal responsibilities placed on medical patients, I would like to talk about how Medicare for All eliminates inequalities for people with pre-existing conditions. Medicare for All eliminates inequity within the healthcare system that people with pre-existing conditions face. The employment-related health insurance system is flawed. If we have a healthcare system that is dependent on employment-related health insurance, then the simple act of merely switching a job can change somebody's entire life. Even under the pretext that a person does not switch their jobs, their company could opt for a different insurance plan. This means that people with pre-existing conditions could have their health care fall out from under them just because of their employer. Disabled people are more likely to be at a disadvantage when it comes to income. With a single-payer healthcare system, they won't have to worry about out-of-pocket expenses. People with pre-existing condition and non-able-bodied folks are the most affected when it comes to medical insurance. They already make less than 37% less than their able-bodied peers. So eliminating that prescription and out-of-pocket costs could mean the difference between food and missing out on rent. Single-payer healthcare can solve all of the inequalities we see in our healthcare system. I talked about how uninsurance affects Americans' everyday accessibility to health. I informed you how fiscal responsibilities put on medical patients can change their everyday life. And I addressed how Medicare for All eliminates inequality within the healthcare system for non-able-bodied folks with pre-existing conditions. Whether you're Cameron Fisher with a killer hangover or Gerald Freeman, a professor of economics, you can find common ground in the fact that the healthcare system in and of itself is flawed and it makes profit off of those who are hurt or injured. The next time you will receive healthcare, which is inevitable, it is important to recognize the cost and privilege some of us have and don't have. While we seek the need to receive healthcare, let us reflect and care for each other and think outside of our own experience to realize that healthcare is not a privilege for the few, it must be a human right for all. Thank you.
That's it?